Babies are delicate. If forcefully shaken, devastating injuries can occur. When an infant is gripped at the thorax and forcefully pulled forward, their neck cannot stabilize their head, and their head flings posteriorly. When the infant is forcefully pushed backwards, their head flings anteriorly. If this action is repeated in a violent, sustained manner, injury to the eyes, bones, and almost always the brain may occur. The infant brain is dense, causing it to lag behind the cranium during shaking. This differential movement can cause the brain to collide against the cranium. This may result in cerebral contusion, laceration and edema, as well as shearing axonal injury and subdural or subarachnoid hemorrhage. To understand how a hemorrhage may form, we must take a closer look at the cranial anatomy. 3 membranes called meninges surround the brain. Laying directly on the surface of the brain is a thin membrane called the pia mater. Fibers known as arachnoid trabeculae extend from the pia mater and connect to the second membrane called arachnoid mater. Cerebral spinal fluid circulates between these membranes, creating an area referred to as the subarachnoid space. Tethered to the internal surface of the cranium is a thick fibrous membrane called the dura mater. The dura mater encloses the superior sagittal sinus. Traversing the subarachnoid space are delicate bridging veins. These bridging veins drain venous blood from the brain into the sinus. During shaking, the differential movement of the cranium and brain causes the bridging veins to cycle through phases of stretching and relaxation. The veins are relaxed when the head is in its most anterior point of movement and the cranium is starting to accelerate posteriorly while the brain is still accelerating anteriorly. Conversely, the veins are stretched when the head is in its most posterior point of movement and the cranium is starting to accelerate anteriorly while the brain is still accelerating posteriorly. Although the veins have elastic properties enabling them to stretch, they can only be stretched so far before they rupture. Blood from the ruptured vein may accumulate in the subarachnoid space, creating a subarachnoid hemorrhage, or below the dura mater, creating a subdural hemorrhage. The result is compression of delicate brain tissue, leading to brain damage and possibly death. When an infant presents with a subarachnoid or subdural hemorrhage, in the absence of a reliable cause, medical professionals must consider the possibility of shaken baby syndrome because shaking an infant is rarely admitted.